nih.
Hello. Good morning, ladies and gentlemen. Before we begin, let us quickly introduce myself. I'm the moderator for today's webinar. I'm MJIIT from Faculty of Engineering and Technology, Multimedia University, Malacca campus. On behalf of the organizer, I would like to welcome all of you to our Humanizing Innovation at MMU webinar series. Thank you for sparing your time to be with us for this morning event. Today, we will bring you the journey of COVID-19 pandemic and Geohazard, strategy to prevent future disasters. As you all aware, the main geohazard in Malaysia is landslide, which is typically happen after the heavy rain and in which will bring us another natural disaster, which is flood. Every year, more than 1 million people worldwide are exposed to landslide hazard. In Malaysia alone, there are more than 31,000 landslide-prone areas. Therefore, it is necessary for us to take initiative and look into this issue seriously and subsequently reduce the risk of this disaster. The main objective of this webinar is to raise awareness among the community on geohazard management and prevention in light of the current pandemic and how technology can play a role, in particularly during the geohazard disaster. Next. Today, we are honored to have 3 speakers for different organizations to share their thought and experience related to the geohazard management and prevention. They are the first speaker, Dr. Khamarrul Azahari Razak, Director, Disaster Preparedness and Prevention Center, Malaysia-Japan International Institute of Technology, University Teknologi Malaysia Kuala Lumpur. The second speaker is Mr. Jasmi Hassan, CEO MSD Innovation Sdn Bhd, and last but not least, Professor Engineer Dr. Hairul Azhar, Abdul Razak, Vice President of Research, Industrial Collaboration and Engagement, Multimedia University. Ladies and gentlemen, Dr. Khamarrul Azahari Razak is currently the Director of Disaster Preparedness and Prevention Center, Malaysia-Japan International Institute of Technology, University Teknologi Malaysia Kuala Lumpur. He received a PhD from MJIIT-Universiti, Faculty of Geoscience, the Netherlands, with cooperation of Faculty of Geoinformation Science and Earth Observation, University of Twente, United Nations University, Disaster Risk Management Center for Spatial Analysis and Risk Management. He was the International Visiting Researcher of Disaster Prevention Research Institute, Kyoto University, and Asia Disaster Reduction Center, Kobe, Japan. He is currently a member of Climate Change and Disaster Risk Reduction Group, Global Young Academic based in Germany, the voice of young scientists around the world. He is also the member of the Technical Committee of Asian Civil Engineering Coordinating Council, TC21, Transdisciplinary Approach for Building Societal Resilience to Disaster based in Japan. Let me introduce the next speaker, Mr. Jasmi Hassan. He is a CEO of MSD Innovation Sdn Bhd. In 1993, Mr. Jasmi started his journey in the business world, participating in recycle industry through Medan Sedunia Sendian Berhad. In 1995, MSSB became one of the biggest exporter of waste paper with the capacity of more than 5,000 metric tons a year. When internet started its way in Malaysia, MSSB decided to expand its business in the field of IT. Internet being the focus of the company, Medan Sedunia Digital Sendian Berhad was formed at the beginning of MSD Group. In year 2000, Mr. Jasmi became the first person to operate the first telecenter under the Pusat Internet Desa program for the Ministry of Energy, Communication and Multimedia, hence the start of Malaysia Bridging the Digital Divide initiative. MSD currently operates more than 400 Pusat Internet community for Telekom Malaysia Berhad. In 2014, he started the development of wireless sensor network, and in 2015, Siphon in Kota Belud was deployed under Malaysia Communication and Multimedia Commission or MCMC Smart Community Program. Today, WSN is widely known as IoT, and NSD innovation under Mr. Jasmi has widened the focus area, including environment, agriculture, and health. Let me introduce the last speaker. Engineer Dr. Hairul Azhar is a professor at Faculty of Engineering, Multimedia University, Malaysia. He is currently served as the Vice President, Research Industrial Collaboration and Engagement, where he oversees planning, management, and monitoring of research and industry engagement of the university. He has served MMU for over 23 years, starting off as a tutor and later served in several capacities, including Dean of Research, Director of Research Collaboration, and Director for Research Management Center. Resulting for these research endeavors, Prof. Hairul have published 148 peer-reviewed papers and 78 conference papers. He has filed 2 patents and granted 6 industry designs. The research team have collaborated extensively, both nationally and internationally, spanning across academic and industry. In year 2014, he has awarded Top Research Scientist Malaysia by Academy of Science Malaysia. He is passionate of making research impact and importance of multidisciplinary research, where one of the focus lies in intelligent disaster management. Ladies and gentlemen, without further ado, I would like to invite our very first speaker, Dr. Khamarrul Azahari Razak, from Disaster Preparedness and Prevention Center, MJIIT-Universiti Teknologi, Malaysia, Kuala Lumpur. Let's listen to his sharing on lesson learned and new strategy to cope with dual challenge of COVID-19 pandemic and Geohazard. Dear audience, if you have any question and you wish Dr. Khamarrul to answer, you are most welcome to post them in the chat box. The speaker will pick up the question and reply them during the Q&A session. Let us welcome again Dr. Khamarrul. Over to you, Dr. Khamarrul.
Thank you very much, Dr. Chan. Yes, can you hear me, Dr. Chan? Yeah, thank you very much. It's my great honor to be here today. Thank you, MMU, for the invitations. In fact, I'm pleased to share some of the experience and lesson learned, and perhaps consider some of the new strategies to cope with dual challenges of COVID-19 pandemic and geohazard. As introduced by our moderator, Dr. Chan, I'm currently a Director of Disaster Preparedness and Prevention Center based in UTM Kuala Lumpur. So today I will be speaking on this title, both sides, on the pandemic as well as on the geohazard in the context of disaster risk. So let's have a look my slides. Yes, so if you can go next slides. For today, I will be addressing some of the elements regarding the disaster risk at the ASEAN level, at the national level, we will look into some of the current challenges and barriers, and perhaps during this limited time, I will be sharing some of the untold story from field and share with you some of the lesson learned, recommendation, and some secret recipe how to deal with these multi hazard and also systematic risks. And perhaps I will be um, share some of the new proposed strategies for disaster risk reduction and resilience. Next, for next two slides, I'll just share some about our center vision and mission. As you can see on the screen, we were established back in 2015, and we are now making 2030 transformation plan, looking forward to support some of the global and regional agenda to reduce future risks. We have partnered with many international network and organizations. Next. And of course, with the great support of Japan government through Japan International Cooperation Agency (JICA), we have achieved significant achievements in the last 5 years. And now we're looking forward for the next to pause on the global and single issues which may need multiple solutions. Next slides. Coming back to COVID-19 pandemic, as you can see on screen, on the left side it shows the current scenarios at the global level, and on the right side, in Malaysia we are currently in the lockdown, and there are few elements that I will be addressing today. Of course, we look into how we can learn from this COVID-19 pandemic, particularly deal with climate-induced disaster, and hopefully some of the strategies that we are talking about today can be practically and locally implemented. So let's have a look. Next slides. Of course, we heard about Kita Jaga Kita. I think there's also coming back from the originate secret recipe from Japan, where they promote these public helps, mutual help, and self-helps. So I think we have been using this recipe in the last few years. And of course, I think how we can learn from these COVID-19s, you can translate directly into this climate change. On the left side, you can see, I think instead of focusing only on the COVID-19 pandemic and also economic crisis, don't forget about the major issues that we are addressing, in fact, by the global society on the climate change, and of course, some of the impact we can still face. Let's have a look at the ASEAN level in the next slides. You can see these global climate risk index shows, at least in the particular, the ASEAN countries, including Malaysia context, are increasing, and we have to make sure that the multi-hazard assessment, the exposure analysis should be continuously assessed. And that's why I think science, technology, and innovation play a significant role to quantify some of the hazards, some of the exposure, as well as looking for the possible risk reduction in the future. Let's put it in the context of Malaysia, flood and landslide in the next slides. You can see, based on the AMA reports issued by AHA Center, it indicates a significant numbers of population exposed to flood in Malaysia. Something scary, of course. And DID, Department of Irrigation and Drainage Malaysia, has mentioned about 20% of our populations lying in this a flood-prone area, and of course, it has a huge implication, especially in the economic losses. And for landslide, in the next slide, you can see Malaysia also considered as a top 10 highest in the frequency of landslide. So if you look at on the right photos, it shows some of the diagnostic features, how we can recognize some of the features of future landslide that leads to this slope failure in the future. But interestingly, to highlight that there are about 26,000 hotspots nationwide on landslide watch, on top of the 16 plus thousands on the existing one that are monitored by DID, by public work departments. So if you look at some of the figure from DID, from JKR, and how we can look into these multi-hazard scenarios and looking for best solutions. Next slides, talking about the multi-hazard assessments, risk assessments. Of course, we are talking about spatial and temporal probability of the future hazards and risks. And there are ways to quantify the vulnerability, either it's a physical, social, and economic. But of course, something that I would like to highlight for today's sessions is about systematic risk. I think it was also mentioned by United Nations Office for the Disaster Risk Reductions documents produced about 20 years historical records and disaster reporting mentioned significantly about the attentions to address this risk, systematic risk. Of course, I think putting back the puzzle, how we put it in the context of COVID-19 that we face at the moment. Next slides. It's very important. In fact, it's very timely to rejuvenate our society, look for the best solutions. Next slides, please. And you can see that our decision makers, policy makers, disaster managers, professionals, everyone play a major roles. And of course, coming back to these multi-challenges of COVID-19 pandemic, extreme weather event and climate-induced disaster require a significant local capacity to address with. So I think we are very happy, very excited to support the process at the national level, at the local levels, particularly building our local capacity through raising awareness among the local governments, providing tools, maps, technical assistance, and perhaps look into how we can learn from one city to another. I just want to share in the next slide, you can see back in 2019, the Federal Departments of Town and Country Planning, Plan Malaysia has published national guidelines on developing a planning for disaster resilient city. It shows based on these 125 indicators. I was part of the consultant teams. We measured the climate resilience index over 12 cities in Malaysia, covering 6 different type of disaster. Unfortunately, we couldn't consider COVID-19 at that particular times because we never knew the scale and impact is at this level. And of course, Malaysian government is currently working to produce, at least launch the National Disaster Risk Reduction Strategies. I think these are very timely for us to look how we can translate some of the national DRR strategies to the local level. I think there are significant role by the local governments, local council to strategies. Let's have a look in the next slides. You can see this hierarchy of the development planning, how we can mainstream some of our disaster risk reduction strategies, initiative and action into the development tool. So as you can see on the screen, there are many levels at the national, state, district, or even special area plan. So of course, these disaster-related maps are very valuable to help the planners, the decision makers, the policy makers into making good decisions, particularly to reduce future risk. Of course, there are significant role by other stakeholders, especially local authorities, technical departments, including developers or consultants. Let's have a look at the context, how actually this study or this national guideline can be replicate at the local level. But this time around, I'm talking about these World Heritage Site, some of the site related to this UNESCO World Heritage Site. In the next slides, please. You can see we have been working in Langkawi, one of the, I think, UNESCO global geopark in the world. And also we are working some of the case study scientific research in the Mount Kinabalu after 2015 Sabah earthquakes. And we published recently papers on assessing earthquake-induced debris flow risk in the first UNESCO World Heritage Site. And we are working on 3 papers to publish related to this Georgetown UNESCO World Heritage Site as well as in the Penang Island. So what we learn, this multi-hazard risk assessment is a best tool for the governments, especially the local governments, to deal with the complexity of the systematic risk. And of course, in the next slide, you can see also some of the ongoing research carried out by my postgraduate student, Mr. Saiful from JMG, who look into how actually the disaster risk reduction strategies and initiative can be helps the managing the geopark in Ipoh. So something that interesting to highlight that the complexity of the hazards, well, maybe in the next 20 years, by considering that the urbanization rate in Malaysia is expecting up to 85%. So we may expect with the climate change, land use change, the numbers of disaster in the future are increasing. Next slides, a couple of slides to show some of my own experience together with many partners from NADMA, APM, from Bomba, of course, with the great support of JICA and some private sectors. We travel, we had this disaster relief and rapid assessment. So at that particular time, we had about 50,000 people actually in the evacuation center. So let's see some of the lesson learned or a story from the field. Next slides. And this also rapid assessment allow us to meet the disaster managers at the local level, at the state and district level. We went to PKOB at the state level and also the district level. We understand the needs and demands. Next slides, you can see there are many story actually of best practice that we can learn, especially how we can deal with flooding, climate-induced disaster, landsliding, while also focusing on the pandemic, COVID-19 pandemic. So it's something remarkable to mention here that there are about 125,000 people, displaced people, during this recent monsoon, from November 2020 until March 2021. So in the next slide, you can see some of the photos. We went to the field, meet the stakeholders, instead of just about these disaster relief activities. We went to the evacuation center and meet the people over there, and it gave us a better clue what actually happening, how we can downscale some of the research into something that easy to implement in the field. So we have learned a lot, and of course for this short period of time, I just want to share some of the key lesson in the next slides, please. Some of the untold story from field, how we actually translate research into practice, what's into action. Looking at the risk governance, risk communication, actually how from the prediction, early warning into the local action. So these are some of the photos, videos cover over Kampung Jeransang in Jerantut. Just a few days after the major flood in Sungai Pahang, we were there and we met the local leaders and understand about the issues and how does the early warning system installed by the ID helps them to early evacuations. So, well, moving from policy, technical into the data assessments, that's all play a major role. And I would like to go for the last part of my presentations. In next slides, please. Um, Talking about the model, talking about data, talking about how does the science, technology, and innovation can help the disaster managers. I have listed some of the challenges, talking about mapping, analysis, assessment, modeling, early warning, prevention, to lead these disaster risk reduction strategies. Of course, there are many model available. There are many scientists working for the solutions, but some of the solutions are not applicable at the local level. I think it's very timely to for us, especially the academicians, scientists, to look into the local needs and demand, and perhaps parameterize our model, and perhaps some of the maps, some of the decisions that we recommended can be locally implemented. Let's have a look at some of the 8 steps in the next slides. We presented these slides in the Penang State last couple of years after the major flood in Penang. And we come up with these 8 practical methods. Of course, we are in the process of look for the local partners, how we can implement some of the locally lead event and program community-based and engaging, empowering local governments. Based on these 8 practical methods, we can look into better strategies and local actions. Let's come back from Penang to Sabah. I think Mr. Jasmi, in the next slides, please. Mr. Jasmi will be talking more on the Kota Belud case, but I just want to highlight that 30 seconds of shaking resulted in 2.84 billion USD economic losses after 2015 Sabah earthquakes. And some of the cascading impact you can even feel until now. So talking about Kota Belud is a rice bowl of Sabah. There's a huge impact to the food security in the area. And I do hope that Mr. Jasmi will discuss on some of the technological solutions that we produce, and hopefully the innovation can help to reduce and prevent some of the future risks. Next slides, please. This on the left side, you see a new tools, guidelines and documents published by UNDRR and WHO, how we can actually empower this emergency response, disaster risk management framework, public health with respect to this COVID-19 pandemic. And on the right side, you see these are 3 major components by Van Westen indicates about these technical assessment, data management. How does these 2 components can help the disaster manager, decision makers? So I think it's very timely for us to look into the demands, look into the needs and also requirements by the policymakers. I'm running out of time. I just want to end my presentations today by sharing 5 strategies to reduce future disaster risks. First one is on knowing our local risks and, of course, the impact, how we can strengthen our risk governance and communication. And third one, how we can empower local champion and indigenous knowledge. Very valuable things, but I think we tend to forget some of the traditional knowledge and local knowledge. Last but not least, of course, these are public-private academia, civil society partnerships, as well as these DRR investments, and how we can rebuild, at least promote these Build Back Better concepts into reality. So we put it, these next slides, we put it these strategies into a professional training module. I'm having a short time here to explain every single detail. If you are interested, you just know. I'm happy to provide the information and perhaps discuss more about that. My last slides, Dr. Chan, before I hand over, 5 take-home message. First one, we have to accept that somehow or rather we have to live with this risk. That's what we face with COVID-19, and how we can embrace nature, how we can make use some of the science given by nature. how we can empower the people, how we can rejuvenate some of the local knowledge. Very important. That's number one. Number two, how we can advance science, technology, and innovations. But once again, the solutions from the scientific world, must be locally or practically easy to implement. Rapid educations, and of course, it's a high impact, of course. But talking about disaster resilience, this is something the disaster world is not deal with so-called these like what we did in the business world. That it's not easy to see the return. So that's why we have to use scientific-based decision making or evidence-based into the decision making process. And number three is about the co-creation process. I think we have to empower the local champion, the local actors, so that we can replicate some of the solutions at the local level to the different region that face similar issues. And last but not least, on my side, I just end my presentation on the quotes that sustainable developments cannot be achieved unless disaster risk reduction is reduced. With that, thank you very much, and Assalamualaikum, and have a great day. Stay safe, everyone. Dr. Chan, over to you.
Thank you. Thank you very much, Dr. Khamarrul, for the fruitful sharing on the strategy and planning of reducing the risk for the geohazard, even towards a multi-hazard in Malaysia. So we will proceed with our next speaker, which will be the Mr. Jasmi Hassan from MSD Innovation Sendian Berhad. Let us listen from Mr. Jasmi sharing on experience of Siphon in managing disaster risk, particularly in Kota Belud. Way forward plans for upgrading Siphon with prediction capabilities. Ladies and gentlemen, again, if you have any question that you wish Mr. Jasmi to answer you, you may post them in the FB chat box. Let us welcome Mr. Jasmi Hassan. Over to you, Mr. Jasmi.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and good morning to everybody. Thank you, Mr. Moderator, Dr. Chan. First of all, I would like to thank you, MMU, for inviting me in sharing what we have done in Kota Belud. Thank you also to Professor Engineer Dr. Hairul Azhar for inviting us also. Okay. First of all, I just want to introduce myself. I'm Jasmi from MSD Innovation, and we are based in Cyberjaya. Actually, we are close by to MMU. You can say a walking distance, or maybe if you drive, it's within 5 minutes drive maybe. Okay, next slide. Before I talk too much, I better go on with the slides. Next slide, please. Okay, let's go to the agenda. First of all, today I will introduce ourselves first, who is MSD, and then a brief project, brief about the project. And later, after that, we go into Siphon version 1, which we developed, and then continue to version 2. And then after that, what is happening to Siphon now with the current pandemic, and then moving forward. Next slide, please. Okay. MSD Innovation started in 2014. It is a small startup. Our chairman is Tan Sri Halim Shafi'i, operation in Cyberjaya. Most of our program are based on community. That means whatever we do, the impact must be towards the community. And somehow or other, this is something very addicted. Since even now, when we do we do other programs, it will also must be connected to the community. For example, in security, even in security, now we are proposing to the government, we are going to propose that we're doing security for prison. So we are trying to enhance the program into development of prison inmates. So being a company that involve community, I think you cannot run from the main objective. Our longest product is basically a community development under the Rural Community Program. So now currently we are running 400 over pusat internet. And in 2015 we started IoT. And currently we just started something new. We are collaborating with another company. We are doing telemedicine, and basically hopefully we can bring this telemedicine into the new program of Siphon. Next slide, please. Okay, so now we go into the project brief. This project actually is under the MCMC Smart Community Program. There was 3 Smart Community Program back in 2017. One is in Kemaman, Lundu in Sarawak, and the third one is in Kota Belud. So Kota Belud, we were entrusted by MCMC to come up with the program to monitor, not to say monitor, to monitor the water level of the river so that we can predict the disasters which are coming. Like just now Prof Hairul said, not Prof Hairul, Dr. Khamarrul said during the shake of 2014, because of that, once upon a time when Kota Belud, there was no flood in Kota Belud during 2014. But after the shake in 2017 itself, there was 88 times of flood in Kota Belud. So that's why we deploy our program there, and the river becomes shallow, and basically every month there's flood. So I think Kota Belud holds a record in Malaysia for having the most flood. That is in 2017, 88 times a year. So basically every year there's a flood. Okay, next slide. Okay, the objective basically of the program is, first of all, like I said just now, is under the Smart Community Program initiative. And number 2 is to utilize IoT as the technology for monitoring or giving early warning to the community, and then creating and developing a system to help local authority and collection of data for future use, that means for predictive use, and providing early warning to community. So these are the basic objective of Smart Community, of the Siphon project under the Kota Belud Smart Community. Sorry. Next, please. So we started with Siphon 1.0. Siphon 1.0 was deployed in 2014, like I said. This is the deployment lah. Basically, we just put a few sensors in rivers, and if you look at the picture on the top right, you can see how beautiful is the river in Kota Belud. Please remember the picture, because afterward you will see another picture which doesn't look like this. Okay. All right. So the next one is basically, if you can see between Kota Belud is in between two very prominent names. One is Mount Kinabalu, and the other one is South China Sea. So it is linked up through a river. In Sabah, it's a bit different. Even though it's one river, in one river they have so many names. So it will start with Sungai Kedamaian, Sungai Tempasuk, and Sungai Abai. And there are a few other rivers that is connected to the main rivers. There's Sungai Wariu, Sungai Gunding. So the distance between Mount Kinabalu and South China Sea is 60 kilometers. And Kota Belud lies 50 kilometers from Mount Kinabalu and 10 kilometers from South China Sea. So at the beginning stage, which is in 2014 or 2015, we just deployed two sensors, which is a water level sensor, and it was placed in Sungai Kedamaian and Sungai Tempasuk. So this was in 2015. For your information, during this time, MSD have got no knowledge of what is a sensor. We started from zero, We just buy sensor from a few vendors overseas, bring it here and just put it up in Kota Belud. So that was in 2015. And during that time, when the first flood occurred, we managed to, not we managed, the Angkatan Pertahanan Awam, APM, managed to detect or predict that flood is coming between 30 minutes to 45 minutes. That means from the reading of the sensor and their experience, basically most of the time is about the experience of people in Kota Belud. When the river rise, when the water level rise, they will know when is the time that flood is coming and which village will be flooded. So that was in 2015. Next slide. This is phase 1 of Siphon. Next slide, please. Can I have the next? Oh, okay. This is phase 2 in 2017. So we were asked to put another sensor in Sungai Gunding because there's a small village there which is considered the most prone to flood, and this also helped a lot of things. Actually, this sensor doesn't help us in terms of to avoid disaster. It will tell APM when or where the flood will occur. In a way, when they know when and where the flood occur, they can make necessary arrangement on what action to be taken, or how, even the community, which I will tell you later, on what to do next, rather than wait for the authority to come and help them. Okay, this is 2017. So during 2017, we came up with an idea with APM and the Jawatan Bencana Banjir in Kota Belud to have a better system. Not a better system in terms of prediction, a better system to help APM to predict, which we decide to put extra sensors and to give them more time to get ready. So maybe we go to the next slide. Okay, this is the next slide. This is in 2019. This is very new. We put in more sensors. As you can see, we put one sensor at the beginning of Kota Belud, because beside Kota Belud is Kundasang. So at the border of Kota Belud and Kundasang, we put one sensor, which is around 50 kilometers from Kota Belud. And then we put one in Sungai Melangkap, one in Sungai Wariu, one in Tangginambo, one in Kampung Sungai Abai, and one in Kampung Abai. Why do we put before and after Kota Belud? There's two reasons. One is because the water from Mount Kinabalu, and one is because when there's high tide at the South China Sea. So if people in Kota Belud are unlucky, there will be heavy rain in Mount Kinabalu and high tide in South China Sea. Then they will meet, the water will meet in the center. That means Pekan Kota Belud will be flooded. So normally Kota Belud have got this place, this big field of a football field. So if that happens, the football field will turn into a swimming pool. And it's really bad. Okay. So besides that, we also put other sensors in Sungai Kampung Kaung. We put environment sensor because we want to know the weather. We also put rain gauge. We want to know how much of rain is in Sungai Kaung and also in Pekan Kota Belud. So with this system now that we have, APM can predict 3 hours before the flood comes. So we managed to do the 3 hour thing. That means when it rains in Mount Kinabalu. Okay, another thing about Kota Belud, even though Kota Belud is shiny, there's no rain, but if the rain is heavy in Mount Kinabalu, Give it 1.5 hours to 2 hours, you will see Kota Belud get flooded. So that is the reason why we have to put sensor at the border. We cannot go to Kundasang yet. So now with this system, we can predict like 3 hours before the flood or the water reach Kota Belud. So now, actually, we are a company without any data specialist. So we have not got any partners yet in terms of data analytics, in terms of predictive, prescriptive, or any other things in terms of data analytics. So we hope to work with MMU later on this so that we can understand more on this. Okay, but again, I'm telling you, the system doesn't keep disaster away. We just want to monitor that when disaster is coming so that the authority can be prepared, the community can be prepared. Okay, next slide, please. So this is the dashboard. This is the siphon dashboard. This is the dashboard for our command center, which is based in APM, Angkatan Pertahanan Awam. So as you can see, the three main river is there, Sungai Melangkap, Sungai Kuala Abai, and Sungai Kaung. So normally APM personnel will understand or will know when the flood is coming just by looking at the data here. We have not done any predictive analytic using the data yet. So hopefully the next round when we do this project, we can have this so that it will be a better system. All right. So after that, we go to the next slide. Siphon versus DMS. In 2017, we came up with a system called the disaster management system. So, as you know, all the data collected by the sensors are sent to our server, and from the server, we managed to do a few dashboard. One is dashboard community, which is run by which is loaded at the community level. One is for the authority dashboard, and one is for the command center. The command center is very seldom. Basically, when there's a flood, only the command center will be up. But normally, community dashboard will be the main focus in our system, where when the water reaches a certain percentage, a certain level, it will create an alarm at the mobile phone, so that they know what to do, or they know that flood is coming. Yeah, for us maybe it's just an alert, but for them the first thing they do is to move their cars. As you know, the most important thing and the easiest thing to move is their car. So the car must go first. Then only they will save other things, so that basically, if you talk about other things, are all the documents. Other, I don't think they can save. And mostly after that, the authority will be the next one, where APM or police or bomba, they will know when to deploy. The system is very simple actually, but when you look at the deployment wise, if an organization or an authority knows when to deploy or not to deploy, they will save a lot of money. They will save a lot of cost. Because sometimes when you deploy, suddenly nothing happen, then you waste time, you waste manpower. So with the system, they can roughly estimate when to deploy, how many people to deploy, or where to deploy. So this is one thing like that. This is one of the function of siphon. Next, this is the information flow. How the information flow between the community dashboard, the authority dashboard, the authority command center, and disaster management center. Disaster management center basically is only disaster management center basically is PKOB. It is only open when there's a big disaster. Authority command center basically is PK. If I'm not the Pusat Kawalan Tindakan, if I'm not, is that one. And then the community dashboard is the one that owns by the community. So community will be notified regarding upcoming event, disaster, and then on their mobile apps. And then through the mobile apps also, they can be notified on any authority that is available in the location. And for authority dashboard, we are trying something new where normally people will say about body cam, but we are talking about body GPS. This is what we call track and trace. Because we have our frontliners, APM, that goes all the way to save people. But who are going to save them if they are in trouble? One. Number two, how do we know how do APM know where are their personnel at a certain time, at any certain time, for example? So if they know where are their personnel and they know where are people that needs help, maybe they can deploy the nearest to the certain to the location, and it will save a lot of time. Number one. Number two, normally during disaster, there's help coming from outside. That means if in Kota Belot, the help will coming from Kota Marudu maybe, or Kudat, or maybe Kota Kinabalu. I was there once where one of the lorry that carries all the food got lost because they don't know where is the pusat pemindahan. So with GPS, I think we can help them on to mobilize and to save time. So authority command center normally will send only notification. They will send notification what is the current situation and what is the water level. Do you need to move? Basically, last time what they do is they will ask somebody from an organization, I will mention the organization, to go to the site and to look at the, there's something like a ruler beside the river, and then they will call back on what's the level. So that's why with sensors deployed, they don't have to do that, and everything is real time. Okay. Next. Okay. This is how it looks like in Kota Belot. This is live. This is real time. This is not something that we propose. We are proposing. They are using it now. So if you can see, there are relief center already tagged where the relief centers are. And then road closure. Road closure is very important because Kota Belot is basically in between Kota Kinabalu, Kudat, Kota Marudu. So if Kota Belot is flooded, there's no way any supply or any transport can go through for Kudat and Kota Marudu. This happened, I think, somewhere in the last 2 years, where the flood was so bad that no transport can go through, and they cannot send supply to Kota Marudu and Kudat because of Kota Belot was flooded. So this is also very, very important so that people will know which are the ways that cannot be used and try to avoid. And the last one is the environment and flood monitoring. These are basically what is available now. Okay, next slide. Okay, this is part of the disaster management center system. Where this is very important actually, but I don't think we have this in Malaysia yet. I've shown this to JICA, but they say this is very good. But for example, Pusat Pemindahan Sementara atau PPS. Normally, the only thing in PPS that is available is food and shelter. That is number one. Kota Belot got something different. Most of the PPS are wireless, have got broadband connection, so they are connected. But how about who are at the PPS? How many family? The best thing is what are required by the families. We tried to come up with a system so that we know that if somebody is located at the PPS, we will know how many people have got diabetic, how many people got blood pressure, how many people have got other problems, so that we can make sure supply are available. So this is something that I think we need to look at in the future, because PPS is where they go after the disaster, during disaster. But do we have all the facility at the PPS? So this is also one of the things we're going to put, which is a simple telemedicine program where people can use the system for their health concern. So this is how a PPS looks like. This is during our simulation in 2019. We had a simulation in 2019. There's no flood actually, but we did a simulation with Pejabat Daerah Kota Belud, and we used the system, and I think the system worked very well. The only thing, there's a few glitch there and then, but currently we put everything on hold because we can't proceed because of this pandemic. Okay, so the next slide is about what's happening now in Kota Belud. Now there's COVID in our life, around us, not in our life, hopefully. Around us, there's COVID around us. But maybe we just feel COVID. But in Kota Belud, it's something different. If you remember the river just now, the beautiful river. So this is what happened. Next, please. Next slide.
Mr. Jasmi, maybe you need to speed up a bit. Thank you.
Yeah, sorry. Oh, I thought I got so much time. Okay, next slide. Okay, this is the river that you saw just now, the beautiful river. This is how it looks like on the 22nd May 2021. So when you say Kota Belud is flooded, this is why it is flooded. And when this happened, next slide, this will happen to the villages around the rivers. This is last May, 22nd May 2021. So when Dr. Khamarrul said pandemic and disaster, it is happening in Malaysia. All right, so next slide. So currently in Kota Belud, there's 9 villages under EMCO or PKPD, 400 plus positive cases, and May till August is the season of flood. Flood will happen during these 3 months. So what will happen if this thing really, for example, yesterday I have a WhatsApp, but I cannot show everybody. When people ask where is this person involved in this thing, the answer was he cannot go out of his house because his house is under PKPD. So imagine that. Imagine that. All right. So next slide. Okay. So now what's next is, first I think we have to help victim avoid the traveling to clinic or hospital, because when they are in the PPS, they cannot go to the hospital, they cannot go to clinic because of COVID, because of road closure, and then reduce the untreated injuries, and then treat non-emergency condition through telemedicine. This is what we are proposing, to have a telemedicine program as part of Siphon, because I think Siphon we are almost there, even though it's not as sophisticated as the Japanese is doing. But besides that, one more slide, please. Sorry, Doctor, I finish it as soon as possible. All right, so what we propose, not this one, before this. Before this slide, the one before this. Okay, so what is Siphon? Siphon was developed based on affordability. That means, for your information, the whole Siphon program was not funded by any agency. It was funded by MSD. So it must be affordable. Disaster-proof communication. We don't want to be like 2014 when Pahang was flooded, Kelantan was flooded, telecommunication was down, electricity was down, so everything must be ready. We must have a proper inventory system so that we know our PPS are ready to receive all our victims, and data must be correct. And I would like to introduce you to my friend. Next slide. This is Lieutenant Hairul bin Gumpitai. Okay, so this is him in his normal uniform, APM. Next slide. This is him on the 22nd. Next slide. This is him now. So, do we have enough frontliners to manage all of this? So I think that's all from me now. I think I pass it back to Dr. Chan. Thank you very much. Any question you can just send through the chat. Thank you. Back to you, Dr. Chan.
Thank you. Thank you very much, Mr. Jasmi, for the interesting sharing on how to utilize the technology to minimize the risk, especially during the disaster. So we will proceed with our final speaker, which is the Professor Engineer Dr. Hairul Azhar from Multimedia University. Let us hear from Prof. Hairul sharing on geohazard management with prediction capabilities, learning from stakeholder input, the next challenge, prediction of pandemic, evaluation of pandemics, and overlap with geohazard prediction. Ladies and gentlemen, again, if you have any question which you need Prof. Hairul explanation, you can just post them in the FB chat box. Let us welcome Prof. Hairul. Over to you, Prof.
All right, thank you. Thank you, Dr. Chan. I'd like to also welcome Dr. Khamarrul from DPPC MJIIT-UTM. Yeah, and I'd like to also welcome Mr. Jasmi from MSD Innovation. Very grateful to be here and very happy that I have the pleasure of being in the company of all of you, especially our two esteemed speakers earlier. When our research program was being tasked to consider having a webinar, I think it was at the beginning of the COVID-19 third wave, as the number of positive cases started to appear in the thousands rather than the hundreds, as we saw in the earlier first and second wave. So what struck our mind then was, because we have a research program looking into geohazard and disaster risk management, what struck us was that what if we had both the peaks of such COVID-19 waves coincide with geohazards that are common to Malaysia, for example, flooding and landslide. Yeah, so that triggered to a very big question that had to be answered by everyone, because geohazard and pandemic management is not solely the responsibility of the government, but everybody has a role to play, and everybody will be impacted. And that makes all of us stakeholders. And I think today's webinar is with this intention of raising a lot of questions, throwing in possibilities and solutions. Yeah. So next, please. So this first few set of slides is just a sort of background. And I think both our earlier speakers, Mr. Jasmi and Dr. Khamarrul, has done very well in introducing the topic of geohazard. But I think for the benefit of everyone, to limit the scope here, we're talking about geohazard, which means disasters that are naturally or geographically induced. Yeah. So I think in Malaysia, of course, as we do not have volcanoes, we are very grateful, alhamdulillah. But we do have very prominent issues and challenges with respect to flooding and also landslide, especially in the monsoon season towards the end of every year. And of course, we have flash floods here and there. Next. Now, this known geohazard is now being I would even say double whammy, because we are, I mean, the whole world is at the moment being impacted with COVID-19. So this is not a great combination. And as we are all currently being put in MCO as a result of the third wave, or some even say fourth wave, it becomes a very big challenge. And for any complex and big challenge, it becomes very important that all domains and studies relating to disaster management and also pandemic management must collaborate and look at a very integrated end-to-end total solution to manage such challenges in the country. And I think, as pointed out earlier by Dr. Khamarrul, the approach taken by many stakeholders, including DPPC, is to look at geohazard or disasters resulting from natural geographical movement as being something that should be addressed in a multidisciplinary or interdisciplinary way. Now, I guess most of you may know, for example, in MMU, we focus a lot on ICT, computing, engineering, business and law, creative multimedia, and we are not a comprehensive university as such that we do not have a medical school. Neither do we have a school that looks into, for example, chemical engineering. So that heightens even more the need to collaborate with others. Next, please. So what we did earlier, just to throw in a bit of background, back in 2009, 2010, MMU together with UNITEN, Universiti Tenaga Nasional, and also with University Science Malaysia, we put up a proposal with partners in Japan for a SATRAPS JICA funding, which was looking into multi-geohazard, the system that eventually assists governments, decision makers, stakeholders in managing geohazard. So the proposal that we put up back then was in partnership with NIED in Japan, with Chiba University, and a few other partners in Japan, for this multi-geohazard management system. So if you look at this program concept, it is a very multidisciplinary approach that looks into raw data that are being derived, just like Siphon highlighted by Mr. Jasmi earlier. We're looking at telemetric data, data on the ground. We're looking at remote sensing data. All this put into a model that can be analyzed, that eventually produces a risk map for the decision makers, for the stakeholders, that allows a support system, decision-making support system that allows eventually for them to decide whether this river, this portion of the slope is suitable, usable, and so on and so forth. So next, please. So this was our earlier attempt in approaching geohazard management in a multidisciplinary way. The next slide is a block diagram, just to put a bit more details into the system. We have the geohazard centralized data management system that looks at the input from various sources and does modeling and forecasting, and has also a module that disseminates these information to the stakeholders. And this information are in the form of creating awareness, alert, and finally to provide support in decision making. In managing these three modules in the system, we included elements which are social sciences in nature. So it's not only science and technology, but also social sciences, understanding how people would behave and respond to such alerts. And of course, to also mention that all this is only possible with raw data, where data is being provided from remote sensing, from landslide site monitoring, and also at the flood site. Yeah. So this was the original concept for the system that we put forth. The program kicked off for 3 years. It started in 2010, went on till about 2013 with the support from the Ministry of Higher Education. It was very eye-opening as we managed to engage with a lot of stakeholders, including Majlis Keselamatan Negara and so on. Now, the next slide, please. The other angle to this disaster or rather risk management is to include now a tool for epidemic management in Malaysia, and for that matter any country. Yeah. We are proposing that this simulator tool must be a very holistic simulator, in a sense that it is not only looking at the pandemic angle, but also looking at the other angles, from education to society to culture and also the economy. So at the end of the day, the simulator would allow us to then play well in the balancing game between managing health, which is priority, and at the same time not to compromise the economy, not to compromise education, and not to compromise society. And all this put together, as what Dr. Khamarrul was also highlighting earlier, put into context to the Malaysian context and the parameters suited for our country, the culture in Malaysia. Yeah. So it's very important for the simulator, for example, to be able to module, to emulate a module that would emulate the obedience of the citizens of Malaysia when it comes to following SOP. Yeah, it must also be able to emulate this culture in different parts of the country. It must be able to model vaccine acceptance, must be able to model vaccine hesitancy, or even anti-vaxxers, those who reject vaccines, because at the end of the day, pandemic management will, I mean, in the case of COVID-19, at least we can say, does depend on vaccination rate that eventually leads to herd immunity that will bring down R0 in the country. So it's a two-way simulator. You can put in parameters that eventually lead to an output that would help decision makers make a decision. And you can go the opposite way if you had a particular output that you wanted, and the simulator would optimize the different parameters in guiding the people or the stakeholders. What would all these parameters be? And this simulator, put together with the simulators, the systems, the likes of Siphon and the tools that DPPC uses together with the other stakeholders, as a much more complete tool to help the country manage both geohazard and the pandemic. So this is the proposal that we are putting forth, and I think in my concluding remarks, it is very important that, as you can see from this model, it is no one man can possibly be an expert in everything that you see here. And it is very important that public health managers, the Ministry of Health, together with economic planning unit, with economists and mathematicians, sociologists, to come in together to build this simulator module by module to make it more representative of Malaysia, the society, the culture, and eventually how the pandemic will roll out with and without the geohazard happening. So I guess photos that Mr. Jasmi was sharing, I cannot imagine, at the peak of the third wave, we have a flooding situation and people had to be evacuated and be placed into a temporary evacuation center. And, I cannot imagine how SOPs in terms of social distancing and whatnot can possibly be followed dearly or closely as possible. Yeah. So next, please, in my concluding remarks, I think as I was mentioning earlier, it's very important that all of us collaborate. Next slide, please. It's very important that the collaboration takes place in order to have an impactful outcome, to see very successful management of geohazard and pandemic-related risk in the country. Yeah. So with that, I thank you. Won't take too any more of your time. It's been a great pleasure again having the two other panelists. Thank you, Dr. Chan, for moderating. Over to you, Dr. Chan. Thank you.
Thank you very much, Prof. Hairul, on the sharing of the new ideas of geohazard management system and also the capability of the new system on the prediction of the multi-hazard. Right. Okay. So anyway, due to the time constraint, we will not proceed with the Q&A session. The question posted or the comment posted in the FB, we will answer in a separate session by the panel later on. All right. Okay. So we will proceed to the conclusion of this event. Okay, we are near to the end of this webinar. So as the closing remark for this webinar, both geohazard as well as the COVID-19 is no longer something that is very far away from us, but it can be happen anytime and anywhere. So in order to reduce or even prevent the disaster risk, all the stakeholders, which include government agency, Institute of Higher Learning, as well as the community, need to put their hand together to realize a real-time monitoring and prediction system for geohazard, as well as the COVID-19. So to end the session, maybe can we have one more last sentence from each of the speaker as the takeaway point for this webinar. So let us start with Dr. Khamarrul Azahari Razak.
Yes, thank you, Dr. Chan. On my last notes, COVID-19 pandemic is real, climate change is real, and disaster risk is real. So let's act now. Let's advance our science, technology, and innovation to reduce and prevent the risk. Let's rejuvenate our disaster risk reduction strategies. With that, thank you once again, Dr. Chan and you.
Thank you, Dr. Khamarrul. So now I would like to invite the second speaker, Dr. Jasmi Hassan, to have the last sentence or takeaway point.
Thank you, Dr. Chan. Just a simple word. I think we have to work together towards solving all these issues. But the most important thing is to make sure whatever we are developing or solutions that we're coming up with must be accessible, easy to access, affordable, and practical. But the key word is affordable. Because when you talk about disasters, people will talk about by the millions of ringgit, by the millions of US dollars. So this is what's happening to Malaysia. So hopefully, with the academicians, with the corporate people, so we can come up with something simple but proven. Thank you, Dr. Chan. Thank you, MMU.
Thank you, Mr. Jasmi. Now, I would like to invite Prof. Hairul.
Thank you, Dr. Chan. I think I'd like to echo both Dr. Khamarrul and Mr. Jasmi. I think way forward is to celebrate all our strengths in the country, rejuvenate and collaborate, not only from the science and technology aspect, also from the social sciences, because at the end of the day, we are doing this for the people, and it's very important that we collaborate, leverage on all our strengths, so that the solution that we come up with at the end of the day is a solution that is effective, something that is doable, which is affordable, that can save lives and save a lot of money and protect our country from such hazards. So thank you again. Thank you so much. Back over to you, Dr. Chan.
Thank you, Prof. Hairul. So before I end this webinar, I would like to thank all the speakers, the organizer of this webinar, the Industry Collaboration and Engagement Center, and Research Industrial Collaboration and Engagement Division, Strategy, Marketing, Admission and Recruitment Division, MMU Studio, and the technical support team for making this webinar conducted smoothly. Last but not least, I also want to thank all the participants and all the audience that are listening to this webinar. And everyone of us, take care and stay safe. Have a nice day. See you again. Thank you very much. Goodbye.
We'll be right back.